TV, and very privileged to host Dr. Gideon Nyakundi. Welcome to the show. And I want to introduce Dr. Gideon. Is currently the Senior Director for Biomedical and Clinical Engineering, Denver Health Systems, County of Denver in Colorado. And I would say I'm very privileged to host you. I have seen you grow as a young man, and I've seen you go up in education. And I'm so pleased with what you have done with your life. Very well, you are, and I know it coincided that we had the same when you were doing your master's, and
yes.
I was completing my PhD. That was very nice that you have also completed your PhD. Welcome to the show.
Thank you, Dr. Mandi. Thank you for the privilege to host me at KGTV. It's a privilege and honor. I'm happy for you to have me and to share a little bit about my journey in education, my journey in leadership, and the challenges, the success that we've been having during these trying times of COVID.
Okay. Now, I know I may assume that I have said all, but briefly tell people who you are, where you come from, so that they know who is this Dr. Gideon.
As you've heard, my name is Dr. Gideon Nyakundi. I was born in Nyamira, Manga, sub-county. I went through Sengera Primary School before joining Kisi High School, and then served the community a little bit before I got the opportunity to come to the United States of America. As anybody else, I came to the United States of America. You know the challenges we go through when you are brand new to the system. I started my career as a PCA, personal care attendant, and then I went to work as a CNA. I worked in the CNA in different organizations, and then during my time of working as a CNA in one of the emergency department, a hospital in Minneapolis, there was an incident that kind of changed my life. There was a young child who had an accident with a stick on the leg. And when the child was brought to the hospital, I was really, because the child was black like me, and it was crying to me like, help me, help me. But as a CNA, I didn't really understand what to do. And I was also moved, like, why can't the doctors just pull out that stick? And when I was concerned, I talked to one of the doctors. The doctor told me, no, we cannot do that. We have to use machines. We have to take x-rays to make sure that there are no tendon damage. And then we have to do an operation to remove it out. That was amazing. And then when I looked at the film for the x-ray, and then I started asking myself, how did this happen? And then I realized that there is healthcare technology. That really motivated me that the doctors cannot really function without healthcare technology. I moved out, and then I joined Medtronics. In Medtronics, I started manufacturing the pacemaker. The pacemaker is a small thing that they insert inside you when you know about it when your heart has a heart condition. So the way we are trained is that you put one micro component and then you give it to the next line, But I was very curious to know about more. At the end of the day, I found myself knowing the entire line and knowing how to manufacture pacemaker.
Okay.
Then I moved to another company which makes laptop ventilators. Laptop ventilators are now heavily used in COVID. Same thing, where you put one component, you give it to the next. But I worked hard to know exactly the entire line. And within no time, I knew how to put together the entire ventilator.
Okay.
Then I moved up to be a forensic analyst. When ventilators kill people, they come to me, I analyze to know exactly what happened.
Mm-hmm.
And then during that time, remember in the US, we had a recession. I lost that job. I found myself with a ton of experience, but without school. That was
Okay.
a waking up call.
Mm.
Soon enough, I found a job with Medivators, a company which makes endoscope reprocessors and dialysis machines. I joined that organization in Plymouth, and that was my very first day. I joined school. I went to school. I got my first degree in
Okay.
biomed and clinical engineering. And during that time, the school invited various executives from different hospitals to give motivational speeches. And I
Okay.
remember one executive from Mayo Clinic gave a speech to the graduating class,
Mm-hmm.
and that executive decided to pick the best student from the class of biomedical engineering.
Mm.
And it so happened that it was me, and I found my very first job to the back to the hospital as a biomedical engineer, Mayo Clinic.
Eh.
So when I joined Mayo Clinic, I worked hard to know different operations, how dialysis system works, for example, imaging systems. And at that point, I saw there was a gap in leadership, especially in healthcare. And I saw that especially in the career that I had chosen, it was almost 100% white. But
Okay.
it's a career that most people didn't know. So I decided to go back to school. I got my second degree in healthcare management
Okay.
from St. Mary's University.
Mm.
And then at that point, I decided to move from a private hospital to work for a public healthcare system so that I can have that touch of our people. So I moved from Rochester to Hennepin County Medical Center.
Okay.
In Hennepin County Medical Center, they were kind enough to take me to so many schools. I
Okay.
learned almost every clinical engineering system, and I became an open heart surgery specialist, technologist.
Okay.
So then that time, I was supporting open heart surgery during the procedure. I set up the machine, support the machines during the procedure, transfer the patient, and set up the machine in ICU to support life.
Okay.
So at that point also, I was in school as well. That's the
Mm.
time you were graduating, and I was doing my master's.
Okay.
Thank you for the mentorship. I finished my master's in healthcare administration and human services, double master's. And then I found myself with two careers, one in administration and another career in clinical engineering. So as a manager, I worked hard, and then at one point, a few years ago, the county of Denver had some challenges in clinical engineering. So they were searching for somebody who can be able to come and lead that system, somebody who had a background in clinical engineering and also in leadership. So there was a search across the US,
Okay.
and the dice fall on me. So
Oh.
they called me from Minneapolis, they brought me down here. I don't regret. I joined the system with some challenges that were there. Took the shortest time to clean the system, coordinate with FDA regulations,
Mm.
and I've been leading that system up to now as a senior director. And then I don't regret, and I enjoy it every single day. And then lastly, school never stopped. I
Okay.
continued with my school, and then now I just finished my doctorate in administration.
Well, that's a very impressive CV you have there, and
Yeah.
congratulations for that. Now,
Thank
exactly, many people may not know Gideon, but what, as a director of biomedical engineering, what do you exactly do?
That's a very good question, and I really love that question because I also want our people to understand what is biomedical engineering, what's biomedical technology, because it's a very, very exciting area of expertise. Biomedical engineers are people who look at books, they look at systems, and then they look at the human body. They look at a problem and they design a medical device. They design a medical machine that can be able to extract data from a human body and then give that data to a doctor to know exactly what's the problem with your system. For example, let's just take a common example of a thermometer. So a thermometer, when we take a thermometer reading, we just take a thermometer reading and we see it's 34 degrees or the 34, 35 or whatever the reading is.
Yeah.
But a biomedical engineer is somebody who designed that thing to make sure that when it shoots a ray, it hits a skin, it reads the temperature or the ambient temperature or the skin temperature, and then modify that reading into a number that can be transferred to a digital number that a doctor can read. Same thing with things like blood pressure. We make a machine that press your arm, get a reading, transfer that pressure into a reading, a number, 120/8 that a doctor can read. We also design and manufacture imaging equipments like MRI machines. And then at the same time, that's the side of innovation and manufacturing. We also support these machines to ensure that when they're being used in the hospital, there is precision. They don't give wrong readings. For example, if you're taking a temperature of a COVID patient and the thermometer is not reading correctly by only 4 degrees, you cannot know that a patient is COVID positive. So we manufacture, we support, we make sure that they are reading a precision. We have standards that we use from NIST to make sure that these machines give correct reading. Yes. That's what we do in the healthcare system, right from the thermometer all the way to the MRI machine, which if it has a dust, it will transfer that image to that dust into an image, and the doctor will say, "Oh, you have a tumor." And it's just a dust. That's what we do to sustain those systems.
Oh, wow, that's very impressive. We don't know. We only go use machines. We don't know that there are people who are tirelessly working behind it. Now,
Yes.
we are in this period of COVID. How has your job been impacted by the COVID-19 as a biomedical engineer?
In my current position, I am in charge of several institutions. I oversee the healthcare system, the hospital system. I am in charge of about 27 community healthcare centers. I'm in charge of school-based clinics. I'm in charge of public health clinics like detention center, jails, they have clinics there. I'm in charge of the ambulance that bring COVID patients to the organization, the entire county ambulance system. I'm in charge of the airport. The airport here, it's the 5th largest airport in the US. It has medical systems inside. So working behind the curtains, we've been greatly impacted. One area that we were impacted was that when this disease came, we as a county, we were prepared for catastrophes. Like, for example, if we have a plane crash, we are prepared. But when this pandemic came, it was a very high magnitude. One thing, we were short of staff. Most people, they don't know about this career. So most of the vendors who service some equipment were not comfortable to come to the healthcare system to service machines. Also, we had a challenge of flipping departments to ICUs. For example, we can go to the ortho department and flip it to be a COVID ICU department. We did not have a guideline as a country, actually. What should a COVID ICU look like? So those are some of the challenges, but I worked very hard with an organization called AMI, which I'm a senior member, Association for Advancement of Medical Instruments, to design what should an ICU COVID room have. So I was privileged that I had designed a highly infectious department within the organization to hold cases like Ebola. So I used that to model and be able to create more ICU rooms. We ended up even converting the convention centers to COVID patients. So the other thing we faced was shortage of equipment because people were looking at us how to invest ventilators, for example. We had a challenge of getting life support equipment. We were just running up and down to make sure that we have enough. And also it was very unpredictable that every day we did not know how many patients we were receiving the following day. So it was one day at a time. So preparing ahead of time was also equally a challenge. Yes.
Okay. Well, now I am impressed that you managed to work on those situations. Now, what are some of the challenges you see generally with your understanding of your background? What would you say, give advice to hospital systems in the US or in the world to combat such a catastrophe like COVID?
Thank you. Let me just use the model that we used here. We found it very, very helpful to partner with other hospitals, to partner with counties, and to partner with other we partnered with children's hospitals. You know, COVID was not really impacting a lot of children. So by partnering with the children's hospital, we were able to get their ventilators that were just in storage. They were kind enough to give us a lot of ventilators to help patients because of the peace. We partnered with California, for example. When COVID was spreading across the US, different states were experiencing different numbers. So some states were high, some states were low. So when, for example, COVID went to California, and then the graph was coming down, there was more ventilators. We were able to partner with California to get their ventilators to the organization here in Denver. Also we partnered with FEMA. I'm a senior member in FEMA. We also partnered with CDC to get the data and also how to manage COVID in starting to reopen and start bringing back regular patients. So partnership is it's a huge deal because it helps you to understand regionally how you are trending, also to get the much needed assistance. That's one very important thing I can highly recommend. And also trying to think outside the box without waiting for somebody to give you that data. We as leaders, we need to look outside, see how other institutions are managing and borrow example for us to design our system to be able to help the people.
Okay. Now, with your experience and advice, one of the things is that COVID-19 has impacted the people of color.
Yes.
When you compare the percentage of the population to the people who are infected, they say every state shows that the people of color are more impacted. What are some of the advices you give specifically targeting to the people of color, more especially like the new immigrants like you who are in this country?
Sure. So yes, you are correct, Dr. Mandi. COVID has really impacted the people of color. There are so many underlying factors. Healthcare disparities is one of the biggest challenges. Impact. The income inequalities is another thing. And also, the advice to my colleagues, people of color, is that we need to keep on pushing to uplift our standards of living, our healthcare, and also how do we manage COVID by observing the regulations that have been mandated, and also taking care of the people who are sick. When we are known to be very, very social people, we shake hands, we hug. We are people who have parties and like socializing. So we have to take precautions, even though life has to move on. But also we have to take precaution that we minimize infections, and also looking at when somebody is infected in our family, in our friends, how do we help this person? How do we help this person while making sure that we are protecting ourselves? For example, offering help with grocery, offering help with, to make somebody not to feel so isolated. Some form of, we have now cell phones that we can call using video. Instead of visiting, use video. If you visit, make sure that you keep distance. And let's take this disease as any other disease. It's not a death sentence. I know a lot of my friends who have recovered from this disease. So let's embrace one another while taking precaution.
Okay. Now, what are you anticipating, if I may ask the question, because even if we have seen that there is a slight change that we are combating COVID, but there is this situation, and now we are in a school year, and in the US, we are trying to open schools. Are you anticipating a spike in COVID again now that the schools are opening?
Very good question. So as leaders, we've been looking at especially the fall, because when fall comes, we have a surge in diseases, especially the flu. Is the flu season coming? So we have been preparing across the country, across the US, designing more ICU beds and other life support systems like that. Also in the schools, I've been involved with the county on crafting ways of opening schools. We started with a small group of students, then we keep on increasing. And then also we were using a system called cohorts, where we don't open the entire system, but open regions. Like, for example, in the mountain region, we had high infection. We did not open those schools. We switched them to online system. But other suburbs that have low infection, we have opened the schools with a very high precaution. Also, we've given parents the opportunity to decide to take their children to school or to have homeschool. And so back to your question about the spiking, it's a little bit unpredictable. We were preparing for a mass increase, but from the numbers that we are seeing, the spike might not be as expected if we observe precautions. Actually, it might be lower than we anticipated during this coming flu season.
Okay. Now, as things are now in the state of Colorado where you are, do you think they have flattened the curve?
Yes. So our curve went up, and then during the riots that we had recently across the state, the curve again started going up. We had a little bit high infection. And then after the riots, the graph has been going down drastically. We had a county command center where every day we were looking at the graphs, the trending across the US. But the trending went down. However, we're having a huge precaution. We are taking a lot of precaution preparing for the fall, as I said, to make sure that if at all the graph goes up, we're ready for it.
Okay. Now that I'm big back question back to the way you are journeying to where you are right now, how you were able to seize an opportunity you saw and then follow it to become a biomedical engineer. Now, what would you advise young people who are exploring careers in other fields who may not have the same chance to be on the position where you are, or even if they are there, they might not try to see the opportunities? What advice can you give them, those who want to choose careers?
Thank you, Dr. Mandy. That's a very important question, in that most of our young people, sometimes they finish high school and they really don't know what to do with themselves. What career is best? The first thing I would like to advise our young people is do something that you love.
Okay.
Where your heart is where your prosperity is.
Okay.
So when you are exploring all those careers, it really doesn't matter which career, even though I try to lean towards advocating young people first to start with technical careers, because technical careers can guarantee a job placement, and then you expound to the area which you love. But most important thing, take careers that you love most. I also realized when I came down here the same problem. So what we have done to help the young people, I have partnered with the state and quite a number of healthcare organizations where we take students of color who are bright, and then we mentor them. We take students a whole semester to work in healthcare, different departments. For example, if a student wants to be a biomedical engineer, we will bring that student to work a whole semester with biomedical engineers to understand whether this is really what that student has. If it's somebody who is doing accounting or IT, we bring this student, partner with IT department. This student will work for one semester with IT to really know that this is what he or she wants. Then after that, these students will go to college, do the same thing, and they have one footage in healthcare. So that's one thing really the state of Colorado has really succeeded. And I'm happy to say that I'm one of the partners in that system. So it's really helping a lot students to learn and at least be able to test. Actually, we have even have some students testing the helicopters, the rescue helicopters, just flying with paramedics to see how that job is. So that's what one thing we are doing. So for my friends who are coming from Kenya especially, take your time and know exactly what you want, and then seek advice, and also, as I said, take careers that you love.
Wow, that is very good. Now that you have gained this experience and you understand the healthcare system, now when you consider how is the state of the biomedical and clinical engineering division in Kenya, where you come from?
First, the biomedical and the clinical engineering system across the world, it's going to be the determining factor of which healthcare systems are going to survive and which ones are going to perish. Why do I say that? Technology has really changed. Now, with the impact, for example, of COVID, we have now patients who are COVID positive, they're at home, but we have innovated technology and medical equipment to monitor these patients while at home. So you take your blood pressure, you take your temperature, that information goes through the system, goes to the hospital, and then the doctors can be able to see how you're doing without you coming to the hospital. If there is Walmart, and medication will come to your doorstep. So also we have a system called artificial intelligence, machine learning. So from Biomed. So this means that we are able now to take your vital signs over a trend of say 3 days, and be able to determine using machines what will be your vital signs tomorrow. If you are going to have a heart attack tomorrow, then the doctors are able to intercept and rescue you. That's the healthcare technology of tomorrow.
Okay.
So in our country, Kenya, yes, we are struggling, and we need to have sitting down there without anybody running them. So it's high time we call upon the country, Kenya, please call the experts to train our local youths, especially to be able to support these machines. The youths are there without jobs. The machines are sitting there without people to run them. What an irony. So we need to have the government help the youth by creating vocational colleges that can train our people, the youths, to run these machines, to innovate and then be able to bring the healthcare technology of tomorrow to our country.
Now, one time I was in Kenya, and I was driving, and I found an accident. Somebody had fallen from, there was an accident between motorbikes. And I volunteered to help transport the patient to hospital, and there is a level 6 hospital. And when we were going, I could see at the shoulder on this patient. So we go there. There was no emergency. You know how you can get frustrated and the way emergency works here. People, at least they take care. We had to wait for a long time. And when he finally saw the doctor referred us to go for it. And you know what? There was only one person in X-ray, and he had stepped out. It was a weekend.
Oh my goodness.
So we were frustrated. I had to drive at night to Tenwek Hospital.
Wow.
And that's a real practical situation. I'm telling you that a person who is, this is a big hospital, people can come anytime they need X-ray, that he was not there. What advice can you give if you are given opportunity to advise people in such a hospital? Why would we have a big title as level 6 hospital, and yet the department does not even have somebody 24/7?
Dr. Mandi, I shared the same experience. Last November, I went home in Kenya, and I was driving to Nyamira, close to a place they called Motemo Muamu.
Okay, I know.
A motorbike hit a young girl, and a rock went through the knee. So I stopped to help. It was late. That was just last November.
Okay.
Luckily enough, I had an emergency kit in my car. So I was able to clean the wound quickly, and then I rushed this child into Nyamira. There was nothing, so I went back to Kisii. There was nothing, and then I had to drive to Kisumu to Akan at night, midnight, with this child in my car. It was that just happened last November. But the child was able to be assisted. Actually, you shared the same story.
Yeah, it was so painful. I mean, to see that people really care. They don't understand about emergency.
They don't. So what?
Change that human capital which is lacking. You find actually people working there, nurses, doctors. They don't seem to be in a hurry. I mean, like we are used here, like it's life matters. We need to help. I don't know. Some suggestion you can give how we can improve that.
Healthcare is a calling.
Okay.
So in Kenya, because of some corruption here and there, you find we are having hospitals called level 3, level 4, level 5, level 6, level 7, level 8, just the name. But when you go inside, it's a big challenge. So in Kenya, I believe the solution is to streamline the healthcare systems, try to remove the cartels, help equip our hospitals and train personnel, especially in technology, train personnel, and also pay them well while holding them accountable. We pay them well, we train them well, we make sure that they have the equipment they need, but then we hold them accountable as well.
That's very good. I think we only, what you are saying here, we continue grading things as level 4, level 5, but the really people working there are still in level 1. They have not been trained to know that now
Yes.
we need to have that measure that now you are trained to be a level 5 nurse, a level 6 doctor, kind of something like that.
So, as you're aware, Dr. Mandi, most of the people in the diaspora from Kenya, from Kisii and Nyamira.
Yeah.
And these people, majority of, there are many, and almost 95% work in healthcare, nurses, doctors, and all that. And these are the people. However, to bring up these people back home, we need to bring, to create a bridge whereby we can link these people. Sometimes we blame them because we really don't have to, because they don't have the exposure. They need the exposure. So I feel like the leadership needs to create a bridge where when we go back home, for example, we can volunteer for 1 week to work in a hospital for 1 week and train our local providers. Same time having providers come to exchange program so that they can come and see how we do healthcare in the US. I know there are thousands and thousands of nurses here who are willing to do that. There are doctors who are willing to do that. But until the leadership creates that bridge to bring this expertise back home, I'll be more than willing to volunteer 1 week to go help. I have been called to Uganda in the month of December 9th. I'll be in Uganda for 1 week to train clinical engineers. So why not in Kenya? So I'll be...
Never gotten such an invitation from Kenya?
No, actually, I've gotten an invitation to Chile. I went to Chile, I trained clinical engineers. I got an invitation to go to India. I went to India for 2 weeks. I trained and I mentored clinical engineers in India. I have been to Pakistan, I've been to Australia, but I've not been invited to Kenya.
Maybe they don't know. Have you tried to contact now that you come from there? Probably they don't know that you exist with that.
I've tried to reach out to the leadership. Sometimes in Kenya, you get to be promised that yes, we recognize, we'll bring you bring the expertise, and then the next day you are told that no, that was a political statement, which is very demoralizing. But in Uganda, they called me. I'm going to the northern part of Uganda. They are very excited to have us, a team. We are going there to train them and empower them and model them to give the necessary care. I hope Kenya, soon enough, probably the system will change and we'll be able to realize these opportunities that the Kenyan people, especially in diaspora, have to be able to help our people home.
Okay. Now, what are some of your future plans? Maybe how you can be able to use that, your wealth of experience, to uplift your home country, at least where you come from. You said you went to Sangara school. So,
yes.
I mean, how can you give back to your community which raised you, that your local community, your county, I mean, your country at large?
I'm curious about it, Dr. Josh, because as a clinical engineer here, as a director, I have been involved here in Denver, Colorado, in establishing community initiatives for the inhabitants and also for the immigrants. Okay. I came here to Colorado, for example, and I found that there was no Mwanyagetinge. I headed Mwanyagetinge. I recruited all the Kenyans here in Colorado. We have a very strong Mwanyagetinge. Okay. I have also reached out to the inhabitants of Colorado, as I told you, to start these initiatives of helping the children across the suburbs. Okay. So back home in Kenya, I am thinking of modeling the same. Okay. Even though there's been a call for leadership, I'm still thinking about it. But in healthcare, I like to model, like in the US, trying to think what can we do? For example, in Nyamira, we have only one hospital, which is very old.
Okay.
How can we mobilize our people to build a new hospital in Nyamira? How can we mobilize our people to have an MTC that we can go as experts and train the youths of Nyamira to be able to give the services and also be a source of expertise to other counties, having our own MTC in Nyamira with very high level of expertise. Those are some of the things I'm looking at. Also, how can we improve on sanitations and environmental care, giving jobs to the youth, especially working online, trying to give them online internet hubs to uplift their lives. Because I believe our youth in Nyamira are very learned. The only thing we need is opportunity.
Okay.
So that's what I'm thinking about our loving home.
Well, that is very good, and we really appreciate your time from your busy schedule. At the moment, if you have any closing remarks, I think we are coming to the end. There's something you want to say before we can close.
Thank you, Dr. Omandi. One thing I really want to share is that one, for the diaspora people, we have been privileged. We had a privilege to come here. We've worked hard. We have succeeded, yes, even though some of us are in the course to success. However, let's not lose hope. Our country is suffering, needs us to get involved. All the challenges we see back home, they need us to solve them. When we point fingers and we stay back, it doesn't help. We need to be involved. We need to put our hands there so that we can change the system. Okay. And my word to the people of Kenya, especially the people of Nyamira, my home, I'm going to encourage you that there is hope. Okay. I know most of you are learned, they need opportunities, but together, if we come together, we can change the system, and not them change the system for us, but us change the system for them. Lastly, remember, when we put garbage in, we get garbage out. We put hope in, we get hope out. Okay. That's my word to the people of Nyamira.
Okay. Well, it was nice hosting you, Dr. Gideon, and we wish you well. And continue doing the good work, and may God bless you.
Thank you so much. God bless you. God bless the people of Kenya as well.
Thank you.